Hi, I'm Dr. GVK Chaitanya Rao, your sinus doctor. Firstly, I would like to thank you all for your overwhelming response to my videos. It gives me great satisfaction to know that some of my videos have helped you make informed health decisions. Coming to today's topic on sinusitis, I see a number of patients who keep coming to my OP saying that they have saying that they have sinusitis. But do they actually have sinusitis? Before I talk on this, you should know what are sinuses, where are they located, what causes sinusitis, what are the common symptoms of sinusitis. The second common question my patients ask me is, how severe is my sinusitis? Please remember, chronic sinusitis is a benign condition, that is, it is not life-threatening in most of the cases. So when they ask me this question, how severe my sinusitis is, I usually ask them to fill out a questionnaire called SNOT-22 questionnaire. By filling out this questionnaire, we can understand to what extent the sinusitis symptoms is affecting their life on a day-to-day basis. Keep watching until the end to understand what is this questionnaire. So what are sinuses? Sinuses are air pockets present around our eyes and nose. There are 5 pairs of sinuses in our body. Frontal sinuses are the sinuses present just above our eyes behind the forehead. Maxillary sinuses are the sinuses present behind our cheeks. Ethmoid sinuses are the sinuses present between the eyes. They extend from the front all the way to the back of the nose. Based on the position in the front or back of the nose, they are called anterior ethmoids or posterior ethmoids. Sphenoid sinuses are present in the deeper part of the nose just above our throat. All these nose and sinuses are lined by thin lining called mucosa. This mucosa produces a thin slimy fluid called mucus 24/7. The mucosa also contains cells which are lined by thin hair-like cilia. These cilia, which line the mucosa, act like a conveyor belt and keep clearing the mucus which is produced in the sinuses 24/7 to the back of the nose. The sinuses are just like rooms in our home, which have but they have very narrow doorways. So what is chronic sinusitis? Sinusitis means inflammation of the sinus mucosal lining. So this inflammation of the lining causes its swelling, it causes congestion and overproduction of the mucus which is normally produced by the nose and sinus mucosa. Now, once there is swelling in the nose and sinus mucosal lining, it causes further narrowing of already narrow doorways of the sinuses. This hampers the nose and sinus mucus clearage mechanisms, and this leads to stasis of the mucus within the sinuses. And this mucus, which is very rich in nutrients, attracts the bacteria, and the bacteria start proliferating within this mucus, and it soon turns the mucus into pus. And whenever there is pus formation, there is swelling all around the area where there is pus formation, and this further narrows the already narrowed doorways and also the drainage pathways of the nose and sinuses. This is how the chronic sinusitis symptoms keep increasing with time. So what are the most commonest symptoms of the chronic sinusitis? Patients who have chronic sinusitis symptoms experience headache. Headache is in the form of heaviness. Patients also experience some form of congestion, swelling and tenderness in the areas where there are sinuses. That is, above the eyes, below the eyes, between the eyes, and some patients experience headache also on the top and the back of the head. Very few patients complain of upper teeth pain. Patients having chronic sinusitis also experience nose blockage. This nose blockage is especially very difficult to tolerate during nights when they are sleeping. Some patients say they have alternating nose block. That is, right nose is working, left nose is closed. By the time the left nose opens, the right nose starts closing. These patients sometimes say that when they are turning to one side or the other side or the same side of the nose gets blocked. So they develop tendencies and liking to sleep on one side of the body. Also, because of the nose block being present since a very long time, some of these patients get accustomed to the nose block. These patients specifically tell that they have nose block worsening when they exposed to cold climate, have cool drink, ice cream or alcohol. Once they are unable to breathe through the nose, what is the option left over? They have to open their mouth and breathe through their mouth. And once they breathe through the mouth, the saliva inside the mouth gets dried. And this leads to bad smell, what we call halitosis. And once there is dry mouth, it prompts the patients to wake up in the middle of the night to sip on water to make their mouth moist again. This particular thing is very difficult to tolerate, and it keeps disturbing the sleep on a daily basis. Some patients with chronic sinusitis complain that there is reduced or total loss of sense of smell. See, the olfactory nerves, the nerves responsible for sensing the smell, are present in the top part of the nose. So when we inhale the air has to brush past these nerve fibers, and that is how we perceive the smell. As we already know, the pus formation, the sinusitis, which causes swelling of the nose and sinus mucosal lining, blocks away this air passageway to the olfactory nerves, and thus we lose the sense of smell, either partially or totally. And smell is very important to perceive the flavor of food. So once the smell is lost, taste is also lost. Some of my patients, they complain of postnasal discharge. That is, there is secretions which are dropping from the back of the nose into throat. And since this is pus secretions which are dropping, this causes irritation in the throat. These patients get so accustomed to it that they don't even notice it. When they're sitting opposite to me and telling about their issues, they keep clearing their throat repeatedly, making sounds like like that. So this becomes a daily habit for them. And these patients, when they're sleeping in the nights, because they don't swallow, there is pooling up of these postnasal discharge secretions in the starting part of the food canal. And when they wake up, they have to put a lot of effort in clearing their throat to bring back their voice, to lose the feeling of foreign body sensation in the throat. Some of my patients also complain about ear pain, muffled sensation in the ear, reduced hearing. There are two tubes called eustachian tubes present in the back of the nose. They have to take the air from the front of the nose to the ears. When these tubes get inflamed because of the sinus issues, they do not function appropriately, and this leads to feeling of blockage as if someone has put cotton in their ears, and sometimes they even lead to holes in the ears. So these symptoms may not look like very big life-threatening issues, but if these happen on a daily basis, this can affect your life to a great extent. So, do you have these symptoms? How much are these symptoms bothering you? So to know that, I'm going to give a link to a questionnaire which you can answer on your own, called SNOT-22 questionnaire, and you can send this to me and I will reply regarding what is your score and how much is the sinusitis issues affecting you. Hope you had a nice understanding of the video. If you have any doubts, you can always ask me. I'm very happy to comment on that. So until the next video, take care and see you.